Hi all, this is Priyadharshini Tutor, SNS College of Physiotherapy. In this video, we are going to see about pedicle flap, tendon flap and muscle flap. These are nothing but the types of skin flap. Come, let's jump into the topic. A pedicle flap. A pedicle flap remains attached to its native blood supply as it rotated, advanced or transposed into the defect. Indications of pedicle flap, and before going into that we have to know what are the conditions in which we can do the pedicle flap. Burns, wounds and ulcers are the main conditions where we can perform the pedicle flap. In burns like deep or full thickness burns, exposed tendon, bone or joint, hand burns, facial burns and post-contracture release. In wounds like traumatic wounds, crush injuries, degloving injuries, open fracture and soft tissue defects. In ulcers like sacral pressure sores, ischial ulcer, trochanteric ulcer, diabetic foot ulcer. Advantages and disadvantages of pedicle flap. The advantages include reliable blood supply when compared to the skin grafting, no microsurgery needed and better color and texture match, no faster procedure. It is one of the fastest and safest procedure. Disadvantages include limited reach and donor site, morbidity, loss of movement. Next one is tube flap, that is your muscle flap. So tube flap is a distant pedicle flap where the skin edges are sutured to form the tube to protect the blood supply during the stages of transfer. Characteristics includes multi-stage procedure, historical reconstructive method and rarely used now. Indications include burns, severe facial burns, nasal constriction, lip defect, eyelid defect, neck contractures. Wounds like larger, distant, traumatic wound defects. When local or regional tissues unavailable, we can perform the tube flap for the wounds and for ulcer, rarely used in chronic ulcers. Advantages and disadvantages are always better to pronounce. And advantages includes safe vascularity over long distance, useful when no local flap available. Disadvantages includes multiple surgery, long hospital stay should be needed, and cosmetic inconvenience, and it is one of the slow recovery process. Next is muscle flap, that is muscle is transferred alone or only with skin to cover the deep defects. The types include like muscle flap, myocutaneous flap and pre-muscle flap. Common example of muscles which can be flapped are gastrocnemius, soleus, latissimus dorsi, rectus abdominis, gracilis, gluteus maximus. Indications like burns, electrical burns, deep burns with exposed bone, tendon exposure and soft tissue necrosis. In wounds like open fracture, osteomyelitis wound, infected wound, exposed implant or hardware. Implant is nothing but the material which is implanted during the surgery like fractures. And ulcer, stage 3 to 4 pressure ulcers, sacral ulcer, ischial ulcer, trochanteric ulcer and recurrent diabetic ulcers. The advantages are as follows: excellent blood supply, fills dead space, control infection, provide padding over the pressure areas to prevent the ulcers. And disadvantages includes the muscle functional loss or donor site weakness or bulkiness. The indications of flap in burns, general indications are full thickness burns, electrical burns, post-burn contracture release, scar revision, hand, face, foot reconstruction. Indications of flap in wounds like trauma, crush injuries, open fractures, post-debridement defects and infected wounds. Indications of flap in ulcers, pressure ulcers, diabetic ulcer, venous ulcer, osteomyelitis associated with ulcer. The physiotherapy management of after flap surgery includes positioning, pressure relief, splinting, range of motion exercise, scar management, strengthening, functional training, gait training if lower limb is involved in the process or procedure of skin flapping. Summary: the pedicel flap, nearby defect coverage, it is simple and reliable. Tube flap, it is staged distinct transfer, rarely used now. And muscle flap, it is best for deep wounds, exposed bones, ulcers and dead space. Thank you.